I think that there is a bad feedback loop in our system whereby people who have poor health or are poor are tending to put a strain on the planet in a certain way. So for example, a lot of the combustion of really polluting fossil fuels and biomass fuels are by poor people all around the world who actually can't afford greener ways, more sustainable ways of producing energy. And by lifting socioeconomic status in many parts of the world, we have a better chance of being able to transition to much cleaner ways of generating energy. And we have a kind of a conundrum here because many of the countries where populations are advancing in socioeconomic status think they need to follow the same path that we followed in the United States, that people followed in Europe, which is to go through a period of very intensive use of coal for energy. And many of us in public health are saying, wait a minute, let's find ways to leapfrog around that, because it's bad enough to have that kind of energy consumption by a few billion people on the planet of coal and other fossil fuels that create a lot of greenhouse gases. If we say ramp that up to that's 8 or 9 billion people who are generating energy at the level that we use energy that way, we are going to leave a legacy for this planet for many centuries of carbon dioxide that will be creating climate change. And so we need to help people out of poverty, and we also need to do that in a way that is more innovative, that is more creative, that says, okay, how do we get from here to there, but without unnecessarily going through this step where we're creating an incredible amount of not only greenhouse gases, but also incredibly dirty air pollution that's causing disease right now, respiratory disease and heart attacks right now from all the particulate matter and ozone and other pollutants that these fossil fuels are putting into the air.